Hello and welcome everyone to another afternoon tea with docs. I am Dr. Linda, emergency medicine physician from Sheffield, and I'm also specializing in lifestyle medicine. Unfortunately, today we don't have Erica with us because of health reasons, but she will be back very soon. If you're new to us, well, we are here every Sunday at 5 p.m. UK time, bringing you world-renowned health experts, like our guest today, Chef Charlene Nolan. We do this so that we can bust medical misinformation and share practical, evidence-based lifestyle advice that you can implement right away to help you prevent, treat, and reverse chronic diseases in a very supportive community setting. After the interview, everyone who has joined us here on Zoom will be able to speak to us in a private, non-recorded setting and ask away your questions, whatever it might be. Our events and community is accessible always free of charge, and it will always be that way so that everybody can have access to health. But if you would like to support us, now you're able to buy us a cup of tea if you feel like by donating £3, and the link is in the chat, or if you're watching us on Zoom, check it out in the comments. Thank you very much. And today we are up for an amazing story where Chef Charlene Nolan, she turned herself around in her 60s, and now in her 70s, she is living her best life. And not only that, she's helping so many disadvantaged to live as well as she is. She is armed with a degree in public health from Temple University in Philadelphia, Pennsylvania. Char Nolan is a plant-based chef who is an advocate for helping others embrace a plant-based lifestyle. She completed her coursework from the E. Cornell Nutrition Studies program from T. Campbell Institute as well. Char is a graduate of the plant-based professional chef program, where she is also a member of chef instructional team, working with students from all over the globe. At the present time, Char is a faculty member at the Culinary Literacy Center of the Free Library of Philadelphia, about which we will be speaking about. It's really inspirational, where she teaches a plant-based cooking to older adults with chronic diseases. Recently, she has completed an 18-month study to measure the effects of a whole food plant-based diet on the homeless and those who are chronically ill. Char is also a contributor to Veg World magazine, where you can find articles about food trends and the plant-based influencers. Char is also a member of Le Dame d'Escoffier, is that right? An international society for females involved with food. Most of Char's culinary influences come from her Italian grandparents, of course, both of whom were chefs. Char is married and has two wonderful grown children. So thank you very much, Char, for joining us today. Really happy to have you.
It's totally my pleasure. I have been a fan since forever, and I can do nothing but applaud the wonderful work that you and Erica are doing. It's really wonderful.
Thank you so much. And right away, I would love to jump in to learn more about your story to inspire everyone who thinks that they cannot turn their lives around, maybe because they feel a bit too old or so. I believe we can do it, and you're the perfect example to show that it can be done. So let us know, how did it all start?
Well, first I'll preface this by telling you that my wonderful mother died at the age of 66. She had adenocarcinoma of the lung that had metastasized to her brain. She was gone much too soon. My father also died of heart disease and cancer. And I thought that I was living a relatively healthy lifestyle. And I worked at Whole Foods Market. I know in London, the beautiful flagship store in the Barker building on South High Street is an absolutely beautiful store that I have actually visited. But I was working at Whole Foods, and this book was on an end cap. And I remember picking it up thinking, oh, this must be a book for firefighters. because it says that it's a 28-day plan to save your life. And I don't know what prompted me, but I bought the book. And on September 23rd, 2009, I got the book and I thought I could do anything for 28 days. And what happened was that every day I would write down on this little list what I was going to eat on day 29. And it was going to have like cake and ice cream and, you know, all of the stuff that we call the standard American diet. And on day 10, when I got out of bed, for the first time in probably 10 or 15 years, you can see by looking at my hands that I have osteoarthritis, and I didn't have 1 ounce of pain. And that voice came in my heart that said, food really is medicine. So I continued and continued and continued. And at the same time, Rip Esselstyn, the author of the Engine 2 Diet, had just started working for Whole Foods Market, and I was invited to go to a week-long immersion in Austin, Texas, to even study more about the Engine 2 diet. And so I was pretty much hooked on day 10. The premise of the Engine 2 diet is based largely on his father's book. This is Jane and Ann Esselstyn's cookbook, but Dr. Esselstyn wrote Prevent and Reverse Heart Disease. And looking at my parents and looking at my siblings, it became very apparent to me that if I did not take responsibility in a delicious way, that I would probably be headed down the same street as everyone else in my family. So that's it in a nutshell. I exercised regularly when I was much younger. In my 50s, I did a series of marathons. I think I completed about, 8 full marathons and maybe 10 half marathons. And now I have 2 hips due to a congenital anomaly, but I don't let that stop me. I'm still out on the streets, either on foot or on my bicycle or my little treadmill that's next to me. And one of the things that happens to not just me, but other people who engage, there are many reasons why people choose to eat a plant-based diet. For myself, it began as a health thing for myself. It was totally ego-based, that I wanted to feel the best that I could. But then what happens is that through how great you feel, you develop an awareness about the environment, and you realize that following a plant-based diet is the best thing for the environment. And then the next thing that happens is that you're looking for a pair of clogs that are not made of leather, because you then think about the animals who are suffering at my expense to wear leather shoes or whatever. So I think that I have experienced an evolution of being plant-based, whether I don't refer to myself as a vegan, I refer to myself as being plant-based, but that's pretty much it in a nutshell. But when I left Whole Foods Market, I wasn't sure what I was going to do with my life. And I think that the pillars of Engine 2 and Prevent and Reverse Heart Disease sort of became the trajectory for where I was going to go with my life and what I was going to do. My friends who are my age are all retired. And I don't ever want to be old. In the sense that I think that when you retire, you might narrow yourself a little bit. So I went to eCornell. I went to Ruby. Ruby is the world's largest online culinary school. And then I called this man up out of the blue who had a restaurant. And I said, hey, here's an idea. Would you like to do a pop-up dinner with me once a month? And he thought that I was a little crazy, but he was like, yeah, sure. So the thing of it is that this just isn't vegan food. Remember that there's no salt, there's no oil, there's no sugar. So you're cooking very basic but delicious food. And people who would come to our dinners were people who were on the cusp of having some sort of lifestyle related disease and seeing that maybe food could be medicine. So that was always our premise. And the food was delicious. And one day somebody called me up and said, we want to start an after-school program for children. We hear you're the person, yay me. And I have now a 5-year relationship with the Free Library of Philadelphia. As we discussed earlier, COVID has sort of put the kibosh on some things that are going on in the world, but I'm able to do a lot of teaching virtually, which is really a fun thing. And next week I'll be dropping groceries off at the library, so participants to a class can pick up their groceries, go home, and we can cook together the next day. So I think that's it in a nutshell.
Charlene, how old are you right now?
I just turned 72 2 weeks ago.
I can't believe it. That's incredible. And you started all this in your 60s.
I was actually 59. I was going to be 60 in 6 weeks. Yep.
That's a huge difference, but how incredible. And once you started turning your own kitchen around, is that what was the kind of cog in the wheel that allowed you to get that energy to start getting these new degrees and start helping people? Or what was that feeling like?
So, I think in the plant-based world, there's so much information to read. And what I wanted to do is find a place where that information was set up in a formal way so that I would be able to deliver that information to people with, I don't want to come across as like a hippie lady who had some wild information about the benefits of brown rice, but that I wanted to have some solid information behind it. And going to Ruby did the same exact thing, because I've always been interested in cooking and in food, but Ruby really helped to sort of solidify my own interest and foundation in what I would do. So there are no accidents in life, and where you are is where you're supposed to be.
So if those who are in your position right now, and we know that a lot of people are unfortunately struggling, shifting their lifestyle, even if they are younger or older, it doesn't really matter. COVID unfortunately hit all of us, and a lot of people have to reinvent themselves. From a lifestyle point of view, what would you advise them from the beginning? How should they get out of this rotting cycle where we sometimes feel ourselves in?
That's such a really good question, and such a broad question. And I don't know if there is one set answer, but I find in my own life that there are 2 types of people. And I want you to think about being at the pool. You either jump in the deep end, or you're the person who's in the shallow end holding on to the banister to go down the steps to get to the shallow end. So as long as you get into the pool, I don't care how you get into the pool, just get into the pool. So when I made this decision to become plant-based, it was a tsunami for me. It wasn't like, oh, let me try to eat some kale for the day or whatever. So I would think to do this. I always tell people who call me, and before COVID, people would call me up and I would take them to a grocery store and we'd go on a tour, and I'd give them a shopping list and shopping tips, and go to their homes and help them clean out their cabinets so they would get rid of, all the little crunchy foods that are high in fat and sodium. So I would encourage people to lean into it. For example, Meatless Monday or No Meat Monday, whichever it is called, I think is a great way, so that every Monday that there are millions of people all over the world who are trying to do the same thing as you. There are so many resources for that. So I would say to lean in, to do what you know, meaning that if you're a person who likes to eat pasta, instead of eating white pasta, try some whole wheat pasta, or try some delicious rice pasta or whatever. And, it's funny, 12 years ago, if you went to an Italian restaurant, they only had white pasta. So I would take a box of Di Cecco whole wheat rigatoni with me. And I would say to the waitress, could you have the chef just cook up a serving? I don't need it back. You can keep the rest. And what happened is that about a year later, we went back and whole wheat pasta was on the menu. So, you can also be an agent of change without even knowing. So Meatless Monday, lean in. And I always tell people to do what you know. Who doesn't love to eat a salad? I mean, everybody loves salad, but how can you make a delicious salad without having, and this is specifically for people who may have heart disease. Dr. Esselstyn recommends strongly, underscore, highlight, no oil, and I cook without oil. There are wonderful, wonderful resources everywhere for, salad dressings that are made without oil. So do what you know, lean in, follow Meatless Monday. And I say this to just follow your heart. The other thing is, if you have made a bad choice in a food decision, don't let that bad choice become a passport for you to re-engage in what I like to call negative eating. I think we all try to do our best, but I think that staying away from manufactured, heavily salted, heavily sugared, heavily oiled foods. We were talking earlier about getting back to basics, making salads, eating fresh foods, making things from scratch. And it doesn't really take that much time when you think about it. It takes more time to go shopping for the garbage food than it does to put something together. Think about that.
I'd love to hear from our listeners if you have any questions and any struggles that you could share with us in chat that we can bring up. Sure, you not only have turned your own life around, but also you started this program for the disadvantaged. And if we can talk a little bit about that and how did that come about, starting with your first cooking in your neighborhood.
Well, I'm laughing out loud to myself because the first time I taught a cooking class, Fran Costigan is here. Hi, Fran. The first time I taught a cooking class, it was in the basement of a church. And I thought that I was doing such a great job. There I was talking about kale and stripping your kale and, eating plant-based. And all of a sudden over the PA system, and there were maybe 20 people who were all very attentive in this class. And over the loudspeaker, I heard, if you have paid for your donuts, the donuts have arrived. And everyone in the class got up and left to get their donuts. So I remember thinking, oh my God, what am I going to do? When they all came back with their donuts, they wrapped them up, and put them away because they were going to take them home. The fire alarm went off. I was cooking a recipe from the Engine 2 cookbook, and the fire alarm went off and the fire department came to my cooking class. So I sort of chortled to myself because they really wanted to eat their donuts, and then the fire alarm went off. And while it seemed like a comedy of errors, I didn't let that deter me. And the library, the Free Library of Philadelphia, had contacted me and asked me if I would be interested in doing it. It started out being an after-school program for children, and then older adults started to come, or kids. This is the best part. Children would bring their grandparents, who were much younger than I am, but who suffered from, whatever the lifestyle-related condition might have been. And I think I may have explained to you that at the Free Library that I work from at 1700 South Broad Street in Philadelphia, the first floor is the library, and it's called the Health Library. The second floor is a pediatric clinic, and the third floor is a health center, public health center. So there's a lot of activity going on there. And the more that I had been around, the more interested physicians were becoming and actually sending their clients, their patients to classes with little prescriptions. Please go to Chef Shar's class. So I just think there's an evolution. And I think that I'm always at the right place at the right time. Yeah.
Be at the right place in the right time. You have to be ready with the information to deliver. And that comes with a lot of work and practice and preparation. So when you started these lessons, not only did you start people who are disadvantaged, you showed them you can cook really on budget. Did you say £10 per four, or $10 for four family members? All you needed for a dish?
It might even be less than that because it would depend upon where I would get my vegetables. For example, in front of the Free Library is a produce vendor named Mateo who gives me a great price, or sometimes I can get the food donated. which is always a plus, but it's even less than that because I mean, potatoes are pretty inexpensive when when you think about it. So, but yeah, buying in bulk. I spoke earlier with Dr. Linda. I had taken a group of students from one part of Philadelphia, and we took the bus 33 into Center City, and we went to Mom's Organic Market to get them out of the neighborhood. It's a 20-minute bus ride. And the best part is that you could buy so much in bulk so that you only buy what you need, which really saves a lot of money. And I'm still in touch with many of the women and men who came to our classes, and going to Moms for them is like an outing. It's just a fun outing for them, and they know how they can best manage their food dollars. So I think that's the other thing, Linda, is that, part of what I and every one of my colleagues in this arena does is that to dispel the fact that eating well is not expensive. If you're going to buy prepared boxed food, yes, that's expensive. But if you're going to go to an open air market or a farmer's market or a sanctuary garden or whatever, potatoes are potatoes. Potatoes are still pretty reasonable. And in America, potatoes get a bad rap. But the reality of it is that it's what you put on and in the potato that makes it not so desirable, but they're a great source of vitamin C and potassium. So why not eat as many potatoes as you want without feeling, and I never use this word, but guilty. So anyway.
I do appreciate this, because all the time my patients are stating that they are not eating potatoes anymore and they're still gaining weight. And I'm like, but what is the other thing that you're eating next to the potatoes, which is a lot of saturated fats from all the animal products and so on. But the blame, unfortunately, always goes on the little tiny potato.
Well, unless you're from New Zealand, did you read, there was in the news this week, a couple in New Zealand raised a potato that was, let's see, let me do my math. It was 4 kilograms.
Wow.
in size. So if you tell your physician, but I only ate one potato, and it weighed 4 kilograms, that might be a little bit too much. But I think that what we spoke about earlier is that dispelling the myth. Potatoes are a nice food. They're delicious. They're reasonable. You can grow them. Whatever, but I think dispelling myths about lots of preconceived notions about plant-based foods is probably a big part of the job that we do, or something so basic as learning how to cook broccoli the correct way.
Yes, that was a biggie for me when I started cooking plants in like a few years ago. Unfortunately, I overcooked everything and it tasted disgusting, because you really have to know the point when you stop cooking things in vegetables. It can be very mushy and you cook that crispiness out of it. So it's super important that we know the cooking point for each vegetables, I think.
Yes. And the other thing, for example, if you're cooking broccoli, you should not put the top on the pan of boiling water because it will make that horrible sulfuric smell that people don't like about broccoli. So just let it fume up in the air. And frozen vegetables, I also am a big fan of frozen vegetables. If you're not somebody who has access to fresh or who wants to eat, from the closest grocery store, I'm a big fan of frozen vegetables.
Yeah, and also we need to dispel the myth that frozen vegetables are lower quality. Of course, it's always good to have fresh vegetables and fruits, but frozen vegetables have just as much nutrients as those that are not. So better to eat that than to go for junk food. And not only have you started the program, but you also are inspiring medical students. And just to show here to the listeners, these are wonderful medical students who are learning from you how to bring health through nutrition to their patients. So bravo for that. What a wonderful group of students. How do you feel about teaching doctors bringing health into their practice?
Well, they find me. I don't even know. I get these calls from people and I would say, well, come on down. I'll be here, I'll be there, or wherever. I think that it's wonderful. And, it's funny, this group have followed me wherever I have taught in the city of Philadelphia. And each time they would bring other friends with them. They would come and they loved to serve food to the participants so that they felt like they were, the guests always felt so special that the medical students were waiting on them. And then I think that for them, they started planting little seeds to the guests, the people who would come to the class about, lifestyle related and getting out there and exercising and doing your very best and maybe, putting down that salt shaker. So I've been reading some of the comments as they go through, and my way of lifestyle is very, very specific. However, I honor anyone who's not eating, no matter what you eat, if you love it and it's nutritious and delicious and good for you, I think that's wonderful. My own specific slant is I don't use salt. And pardon me, the curious thing is that it takes 21 days to unveil a behavior or a taste or whatever. And we're not born loving salt and sugar. Those are acquired tastes. So if I, for example, go out to eat dinner, and I don't go out to eat dinner now because of, the way the world is, but food will taste really, really salty to me. So I will have to say to the server, no added salt, please, just because it doesn't taste right to me. So, and I'm sure that there may be some others on here. I see that my friend, renowned pastry chef Fran Costigan is here, and she eats a very similar way that I do. And anyway, I'm not seeing anyone. It looks like we may have lost connection. Let me see.
No, we are there.
Oh, okay, there we go.
I'm actually just looking for your friend in the list. What was her name?
Well, one is Fran Costigan, who is the author of a wonderful vegan pastry book. And she is the director of the Essential Vegan Desserts program at Ruby, but like she's everywhere and all over. And I also see Monica Glass on here, who is a phenomenal gluten-free chef. So Monica is always in Philadelphia making beautiful food for people. She's saying hi right now.
If you guys want to come on and say hello, you're always very welcome. Costigan, Fran, would love to have a word with you. But I want to show now.
It's Fran's book. I never have this book too far away. And I'm going to tell you a very funny story. And if Fran is here, I hope I do the story justice. So, a lot of how we look at food in America, as you know, portions are crazy, crazy gigantic, crazy, crazy gigantic. And several years ago, Fran, I was in New York when she was still living there, and she said, I've made you some chocolate truffles. And I was like, oh my gosh, I'm going to eat Fran Costigan chocolate truffles. This is outrageous. So in my head, the truffles were going to be the size of a golf ball, because that's when you see them in the store. Truffles here are big. And when I opened them up, they were the size of a marble. And I sort of laughed to myself and then had this aha stop thought moment that, portion sizes in America are gigantic, and that we really don't need as much food as we think that we do. And she also made for me, because my favorite dried fruit in the world are prunes. I absolutely love plum prunes. I grew up on them. They were a dessert in my household growing up.
I absolutely love prunes as well, in every shape and form. They're just so delicious. Eating them just from the tree or as a jam or in whatever format a chef can put it, I'll eat it.
Well, in America, prunes get a bad rap.
Oh, do they?
Because they're considered to be, dried plums are considered to be the fruit of constipation. for
Oh,
lack of a better description. So I lived in Brazil for 2 years where I was a Peace Corps volunteer, and the dried plum is revered. It's in ice. There's a prune ice cream. There are prune cakes. There are prune puddings. I mean, if you love prunes or dried plums, that's the place to be. But Fran knows that I like prunes, and she's the only person in the world who has ever given me prunes. And I think that that is an earmark of a good friend.
oh, that's very sweet. What a lovely story. And this also brings us to the importance of friendship, society, social connection, and community. And that's what you're doing with your work, with especially those who are most disadvantaged. And that's wonderful. You did say that the group who you're teaching very much understands your jokes as well, which is always a bonus. I think
Well,
there are people who are
well,
in their 70s, 80s.
well, the funny part about it is that years ago, when I first began working with older adults, one of my friends, with all the love in her heart, she said, well, really, this is peer education at its best. And I hadn't thought about that. But if I'm making a reference to someone, I can, look at the crowd, and I can talk about old timer things, and they will just howl and laugh. And I think that my age is a bond for them, because generally I've heard them say things like this: well, we're sure glad you're here, because sometimes before you got here, they would send a young girl and who never got any of our jokes. And that those jokes can actually be a unifier for helping people to engage in lifestyle change or learning to do things, differently or whatever. And I have to say, carrot dogs are becoming very popular in America. Jane and Anne have a recipe for carrot dogs in this cookbook. I like to throw some hickory wood right into the water and cook them that way, instead of using, like an artificial fluid. Anyway, they were like, there's no way that we're going to eat these carrot dogs. This is the stupidest thing I ever heard. And then to take it a step further, I served them on whole wheat hot dog buns. And after one bite, because it had sauerkraut and mustard on it, after one bite, one of them said, they could sell these at the ballpark. I think people would like them because they taste really good. So it does make me happy to know that, what might be first seen as a wild, crazy idea. And I'm still in touch. You're talking about staying in touch with people. I don't mind giving people my phone number. They know I don't like to talk on the phone, but I'll text anybody. And I hear from people all the time. I went to this store, I went to that store. And one last thing, if there are any other chefs or educators online, one of the things that's very important is to do a needs assessment of your community. And when I worked in North Philadelphia, I went to 4 grocery stores. I went to the big super grocery store that was a mile away. I went to an Aldi. We have Aldi and Lidl here. They're very popular stores. I think that you may know them. And then I would go to a corner store or a bodega. And there's a mini grocery chain here in Philadelphia that's owned by a family. And I went to that grocery store, and one of the participants said, I can't believe you went to that grocery store, because you look like somebody who would shop at Whole Foods. So all of my food would come from Walmart or Aldi or Lidl. So I could say to them, when you're at the Walmart and you're on the international aisle, you're going to find this brown rice on the 3rd shelf, because every store has the same planogram. So my point is doing a needs assessment that makes your participant feel engaged and that you are doing something that's very familiar to them. Yeah.
It's very important for anything that we do is cultural and it's local. While we are globalized, I find we can discuss a lot of topics, but whenever we are implementing and we are talking to our patients, it's very important to know what is their background, what is their socioeconomic background, how do they communicate information between the community. Because I found that even if you're just one city away, immediately there's a different way that they pass on information, and the trust can break if you're not doing it well. So whilst it's really good to be globalizing and learning a lot, I think it's very important, if we are doing practical things, that we keep it as local as possible. And I think that's why also your group started off so well, because you really were in the midst of the community. You were sharing and understanding their culture, where they came from, and you could just speak their language through culture.
I think that you're absolutely right about that. And I think that I'm speaking specifically for what I know, many older adults can live very isolated lives. So I think that when you break down the barrier, when you break down that isolation, which is a barrier, and you engage with people, I think that that is a very positive thing. And it's very fruitful, to wake up and get a text that says, I was at Aldi today and they only had kale in a bag, but I bought it anyway because I thought of you, or whatever. I really do get texts like that. And I always say that it's progress that you make, not the perfection. I don't expect people to, I expect for them to do their best and do what makes them feel good. And I think that when people see their blood pressure going down, or they see their cholesterol going down, or their weight going down, or other biomarkers, that those things become for people an incentive, and it lets them feel as though this is something that they've done themselves. The other point I wanted to bring out is that when I write recipes for my classes, I write them in a very large font, maybe a 24 point, so that they're easy for people to read, since many people may not have been to the eye doctor, or they may have difficulty reading. I write them at a 3rd grade level so that they're easy for everyone to understand, because oftentimes I work with people who may have low literacy, and I want them to feel that they can master reading that recipe as well as anyone else. And then I try always to include a photo of what the dish could look like, or if it has a jicama in it or something. And maybe not everyone knows what jicama is. So that you always want people to feel comfortable with what they know and who they are.
So if we have listeners here who would like to spend a little time within their community and bring a bit of cooking into the neighborhood, do you think that's possible? Do you think that they should be inspired to start something?
Well, I think everyone should feel inspired, but I'm going to roll back for a half a second and say that for me in my community, to teach a class, I had to take a course that's called Safe Serve, that teaches me all of the protocols about, food temperatures and maintaining an aseptic area when you're cooking food and transporting food. And then I also have insurance, because if I made something and someone got sick, my insurance protects me from that person getting sick. So, pardon me, if they were to engage, they would want to check with the organization that they would be working with and ask, what kind of coverage do you have, or do you have an umbrella for this or for that? So it is doable, but those documentations are very, very important.
Absolutely. So practical step number 1, getting the documentations done, and 2, where should they start their course? Where should they start learning about nutrition as a warm-up if they have never learned about it?
I don't know that everybody has to know about nutrition. If you're a community member and you have a church that you belong to, and that church has a gorgeous kitchen, and there might be some people who are interested in learning how to make brown rice or quinoa or whatever, maybe you can start that way, and then go down the pike and get the necessary documentation. Most churches who have kitchens in them do have somebody who has Safe Serve, and you could work under their umbrella. For example, I have a food manager Safe Serve, which means that people can work with me who don't have safe serve, if that makes any sense. However, never let anything deter you, because I think that, you know, when I was 50, I used to think, oh, I wonder what my life is going to be like when I'm in my 70s. And sometimes I was in my head, I was in a Riviera somewhere, or I was traveling on a jet, and it's not quite my life, but I don't think I would want to live my life any other way than to, do community outreach and provide information and education. And I'm going to say this with all the love in my heart. I teach many, many different types of learners. And my favorite are my inner city community groups, because they're so eager to learn and they love the attention and recognition that they get. Sometimes I'll bring a friend in, or a couple of years ago, when I was working at this organization called Project Home, one of the nurses said, well, Thursday's a really busy day. It's when they come in for self-care day. And I said, well, what's that? And she said, oh, well, we have, several showers, and we have a laundromat here at the facility, and we invite all homeless people to come in and take a shower and wash their clothes. And I said, well, what do they eat? And she said, well, nothing. So I called Fran Costigan up and I said, hey, do you want to help me cook lunch for, I think maybe it was about 75 or 100 people. And all the participants of my class came early, and somebody chopped vegetables, and somebody made dessert, and somebody made a soup. And then all of a sudden, 75 people showed up. And the funniest part of the story is that I brought a backup of a little soup made by Dr. McDougall Soups. And this man showed up and he said to Fran, oh, I'm allergic to corn. And there was corn in everything this day. There were corn muffins, everything had corn. And Fran said, oh, we have one soup that doesn't have corn in it. So we cooked up this Dr. McDougall. And then here's the best part of the day, is that as people were going through the line, we had a condiment station. And the condiment station had hot sauce and low sodium soy sauce and low sodium tamari and mustard and all kinds of things. And this gentleman showed up and he said, oh, no, not for me. I'm not allowed to have any salt. And a participant who'd been coming to my class for a year said, oh, no need to worry about that here. We don't ever cook with salt because we all want to have good blood pressure. So at that moment, it told me that a teachable moment months ago became an empowerment moment for this woman. So there's a snowball effect to this. And I think Fran and I look back very fondly and appreciatively of that day, because it really was just so much fun.
And that's great. How it should be. So much fun with food, with community, socializing, chatting. And I mean, is there any better way to learn how to live a wholesome, fulfilling, and delicious but healthy life? I think a lot of times we are conditioned to think through marketing that if it's unhealthy, only then is it tasty. But this couldn't be further from the truth. It can be delicious, full of the colors of the rainbow, without salt, added sugars, without dairy products, making it taste creamy, and it will be delicious. I mean, isn't there this misconception that if it's healthy, then it's really, really stale and boring?
Well, I think that's exactly right. And, sometimes if we're talking about that person who's tiptoeing into the pool and holding on to the banister, getting people to change their bread habit, for example, is a very difficult thing to do because everyone likes bread their certain way. But my suggestion, especially when working with children, is have the bottom half of the sandwich be whole wheat, have the top of the sandwich be white bread. And then eventually you're going to get into the deeper part of the pool where they can eat a whole wheat sandwich made with whole wheat bread and not object to it and realize that it still tastes very, very good. So, yeah.
It can be delicious. And so I do love to inspire people here, and your story is truly inspirational. Not have you only changed your life, but that kind of catapulted into changing your community and teaching medical students. So if our listeners are, and now I can see it in comments that a lot of people have been inspired by you. We mentioned to change their lives if they wanted to go and help their communities. What are the advices besides this that you could share with them in a practical way, Char?
Well, I will start off by saying this, that donating food to a group or a church or whomever is a good way to go. A couple of years ago, again, Fran and I and some of our friends got together and we donated plant-based Thanksgivings to, I think, 15 families in a part of the city. And everything that was in that grocery freezer bag was low sodium, no sugar, et cetera, et cetera. So think about donating food that might be helpful for people to use. Yeah.
Especially,
I think that's a good way. I think that's a good way to begin.
Especially now that Christmas is coming, what can we do that is not just buying gifts? We could be actually sharing what we already have rather than buying new things that most likely we don't need. We could share the time that we have with each other while cooking healthy dishes and following your footsteps. That is so inspiring. And what are you going to be doing for Christmas, Char?
I haven't even thought about it yet because it's I think about it probably like the week before Christmas. As my mother always used to say, we're a do nothing family, but we do it together. So I think that will, be a good thing. But I think giving gratitude, and I also did want to say, the Esselstyns have a foundation and they have been extremely generous to me, sending me funds to make lunches for medical staffs so that I'm able to deliver 25 whole food, plant-based, no oil lunches to different clinics. And I've done that 3 or 4 times over the last year, which has been fun. So to go back to that, think about a local clinic or a local emergency room or wherever, where maybe you could donate something healthy to the staff to show appreciation and sort of, just hold on to that banister in the pool. Yeah.
And how does your day look like when you start with breakfast?
Well, I eat oatmeal every day because it's a good source of fiber. It fills me up. It's got antioxidant powers. I never tire from it. I make, when I say sweet, I mean, I'll put fruit in it or I'll make savory where I'll add ginger and turmeric and tomatoes and mushrooms and other things. The savory oats recipe from this book is one of my favorites. And I make a big batch of it and keep it in the fridge so that I don't have to think in the morning when I wake up. I just take a couple of scoops and heat it up and eat it, and I'm on my way. And, it's funny because my husband, since the beginning of the pandemic, he works in the dining room. And then I have this little office that you see behind me. I have a treadmill that's about 2 feet away. But as you know, I love riding my bicycle every day. And I try to stay to a schedule just because it keeps me a little bit more normal. And then I keep very, very busy with my work with Ruby and, interacting with students and being a resource for them, et cetera, et cetera. So dinner time is, I'll eat a big, gigantic salad every day. And I will say that I think that I'm somebody whose life has been impacted just by the presence of COVID. So I really have curtailed my social outside the house activities just because I'm waiting for things to get better. But fortunately, through social outlets like this and other things and the phone and other things. So I keep pretty busy. Yeah.
And now that we always say that with age we kind of got used to this idea that we have to kind of get sick almost, people almost waiting for the sickness to come. And you said that you had arthritis and have arthritis in your fingers that really affected you before your 50s. When did that start actually? How old were you the first
I
time?
think I was in my late 30s.
Wow, so it is most genetic.
Yeah, I was in my late 30s. And I do want to say this, and I realize that there is an individual consideration for every person in the world.
Absolutely.
But here I am at my age, and I take 0 prescription medications, rarely even take an over-the-counter medication for a headache or whatever. And I'm nutty enough that I take my pulse ox to make sure that it's good. And I take my blood pressure regularly to, make sure that it's good. And my primary care provider was a nurse practitioner whom I adored, and she's retired. So I'm in the market of looking for another physician who doesn't think I'm a kook.
Well, if you were a cook, then I wish for everyone to be a cook. Well, because then the world would be a much better, wholesome, beautiful place. And I think we just need to do things the Char way.
Well, I don't know about that, but I will say this to anybody, that if you wanted to read a really good book, for me personally, Dr. Esselstyn's Landmark, Prevent and Reverse Heart Disease is an excellent book, especially if you may have a predisposition to heart disease. And for me, that was the case. And then the Engine 2 book, the difference is in this is that Dr. Esselstyn prescribes no nuts, I eat nuts. So the Engine 2 book, I like this book. And then this book came out a couple of years ago by Rip and Jane Esselstyn. And I have this little thing here because I'm a fan of Rocky Balboa. I moved to Philadelphia because of Rocky Balboa. And these are my Yo Adrian burgers that are in this cookbook. And they're
I need to ask, when did you fall in love with Balboa?
Well,
I mean, I can relate. I definitely can relate.
This is a serious thing. When I was in the Peace Corps, I saw Rocky 5 times in 5 days. Every day I went to the movie to see Rocky. If a Rocky movie comes on television, I will stay home and watch it. Even though it might be on demand somewhere, there's something about it, about his spirit, that I really, really enjoy. And the spirit is never give up. And that's what I hope that I sort of give in my messaging, that food is simple, food is nutritious, and that we all can do our best. We don't have to strive for perfection. We just have to do our best in our own little worlds. Does that make sense?
Absolutely. And I think that's exactly why I can relate to it as well. He's such a fighter, and through the whole 5 movies, he just fought, and you could feel the struggle and the suffering that I think we can all relate to it. So definitely never give up. Keep trying, and basically like one training at a time, one plate at a time, one forkful at a time. But what I really love about food as well, what we I think don't talk about enough, is it really is where communities come together, and that's the second most important like aspect to a plant-based diet, that we can come together and share a community, a conversation through delicious food. And we have so much studies to show that a community and being together can help with our chronic diseases. And now you have just showed that you were able to not get worse with your arthritis, but it got better, even though it started in your 30s. You feel better, you're more lively than before you started this journey, and you have a purpose. I think just a few words about purpose and the importance to give to our community, if you can share that feeling and those thoughts with us.
Well, I was thinking that it's not you just do your best. But I was also thinking about when you are with a group of people, you don't remember the food that you ate. You remember the people who were there. You remember the laughter. You remember, I can remember what people had on, goofy things like that. So people always say to me, don't you feel deprived? And I always say to them, of what? And they'll name some kind of gooey food or whatever. And it's like, oh, I can make, a plant-based version of that and have it taste equally as delicious. Or one of my siblings will ask me, when are you going to start eating, the way that we used to? I did want to say one thing. And if you read Michael Greger, MD, the author of How Not to Die, he often talks about how diseases run in families, not necessarily genetics, but the lifestyle. And my father, who I mentioned earlier, is not my biological father. And the fact that he and my mother, who were not related, both had cancer and heart disease, and my siblings have those things and I don't, tells me that it's what's on the plate more so than the genetics. And as Dr. Esselstyn always likes to say, it's lifestyle that pulls the trigger. So I think that, remembering those important words is a good baseline for people to have. So.
Absolutely. It's not genetics, but it's what we do that pulls the trigger, unfortunately. And we can see this epidemiologically. And it's something to keep in mind, not to empower our genetics and the thoughts around it, because that completely disempowers us from making the changes that you have made and showed us how to do it. Thank you so much for joining us today, Char. I would love to share with our listeners where they can connect with you. I think it's on Instagram you are most active with, where they can see your work.
Instagram is my pacemaker. So they can find me at Char, CHAR _, and my last name is Nolan, NOLAN. Message me, it's easy that way.
We also add your link to the comments below, and we'll share it here in the chat as well, so that you can connect with Char and also get inspired to continue this journey, because you can see that it is possible. So thank you for everyone who has joined us on YouTube. Now, those who have joined us on Zoom, we will go on a non-recorded event where you can now talk to us in private. So thank you very much. Have a lovely Sunday for everyone out there.